The following podcast is for information purposes only. Please consult a doctor for medical advice.
Hello, everybody, and welcome to the May edition of the Modern Medicine Podcast. How is everybody doing today? I am your host, Dr. Dennis Tien of the Beth Israel Lahey Performance Network, here with my man, producer Dave, for this great episode we have planned. Dave, what's going on, my friend? How you doing?
Not much. I was going to say lovely day. It's not that lovely day, but we're getting there, and we got a terrific guest, so I'm excited.
It's kind of a dreary day. We have a terrific guest, a terrific episode planned. We're going to talk about all kinds of stuff today, all the things you're wondering about for the most important information analysis in the world of medicine. We're going to talk Hantavirus. We're going to talk RFK and antidepressants. We're going to talk about a doctor who removed the wrong organ. But before we get to any of that, we have a terrific guest. It is Mental Health Awareness Month this month in May. And we have Celeste Viciere with us, who is the founder and the medical director of the Shifting the Way You Think Wellness Center, which is located right in Stoughton, Massachusetts. It is a holistic therapy and wellness center, but it is actually, and I looked at this, it is staffed by some very credible and legitimate people, including Celeste and her awesome staff. I read all the profiles online, and we're going to get into the whole mental health and stress and how that affects your body and your mind and some of the services they offer that can help people at the Wellness Center. So without further ado, I introduce our awesome guest, Celeste Viciere, licensed mental health counselor. Welcome, Celeste.
Thank you. Thank you so much for having me. I'm excited to be here and have this conversation with you.
Awesome. Well, we're excited to have you. It's Mental Health Awareness Month, Celeste, and I thought, maybe we could start by just talking about, you are the owner and the medical director of the Shifting the Way You Think Wellness Center. So in your website, you talk a lot about holistic mental wellness. So I wanted you to tell me and producer Dave and the audience, what is holistic mental wellness?
Yeah, so I'm a therapist by trade, licensed mental health clinician. I'll be 44 this year. And when I was about 25, I did all the things, went to school, was working, started therapy, but it wasn't enough, right? And I think a lot of times we only talk about therapy and psychiatry, which is great. They're two great modalities. I believe in therapy. I'm a therapist, but I believe that we miss out on the body. And a lot of times our body gets stuck. So a lot of times people have been in therapy for years and know all the things, but there's other things we can do. There's the sun, there's walking, there's moving our body. And so the reason why I created the Wellness Center is because I wanted to create wraparound services for people that might be struggling and maybe they don't want to talk about it, but they want to move their body. And so I want to give people options.
And so physical wellness is a big part of what you do in the center as well?
Yeah, so we have clinicians that work there, but also I partner with wellness providers, and all of the classes there's workshops, but there's also classes where you lay down and the wellness providers put you in different spaces, and it literally will release the stress. People say they leave the class and they just feel so much lighter, and they didn't have a conversation. They moved in different directions.
So is it like a yoga type thing or stretching?
Yeah. So last night we actually had a yin yoga class, and we moved in different directions, and we held that spot for 2 to 3 minutes. You get a little discomfort, like 2 to 3 pain wise, and then somehow it just releases the stress. We have sound healing where you literally just lay there and the bowls are playing, and there's something that happens with the music and the sound that helps your system relax.
That's excellent. And so how does this integrate? Do you do traditional therapy there as well?
Correct. So I do traditional therapy because I've benefited from somatic classes. I wanted to provide a space for people to come to that may want to do that as well. So a lot of times I'll have people that come in for the wellness classes and end up talking to a therapist, or they came in for therapy and end up doing the wellness classes.
That's really wonderful.
Yeah.
And so so what you're doing is really a lot different than what people might get with a traditional kind of therapy experience.
Correct. So for me, when I talk to people, I'm always bringing in the body, but I think what makes my wellness center unique is that you come in and you can see a therapist, but you can also get the physical piece that might be missing. And a lot of times I don't think it's talked about enough in this country. I don't think we talk about the body and the nervous system and how we're so dysregulated. There's just so much happening around the world. Even if you didn't experience trauma, just watching the news can create a lot of dysregulation, and we don't know what to do about it. So we're sitting with all of this dysregulation and nowhere to put it. And so that's why this wellness center is a great tool for people.
Can you talk more about how physical stress and anxiety and all of that can translate into the physical body? Mental stress and anxiety can translate into the physical body, and some of the hormones involved, or some of the science behind it all?
Yeah, well, I try to use analogies, and I think about a car. And if you're pressing the brake and the gas at the same time, eventually, the car breaks down. And I think, with animals, they can roam, and the prey comes, and their amygdala, their fear, fight or flight response happens. And so they get away from the prey. But what happens after that? They go back to baseline, right? They're back at their baseline. For us as humans, because our mind is so complex and so amazing, we can think our way into success. Dr. Tian, you pictured this idea of the Modern Medicine podcast, and you started creating steps, and now we're here, right? But we can also think our way and stay in a fearful state because of things that has happened. And so our mind and system will stay in that state. And so if we're only allowing fear and the trauma of our past and the stress to be a part of our psyche, unfortunately, our body's going to respond the same way. And so even if you're in that state right now, and a lot of people have recognized that they're in that state, but they don't know what to do about it, breathing, I always say, just start with breathing. When I have people that are struggling, you may not want to come to a wellness center. You maybe have a hard time getting out the house. Just taking a time to just take a breath for 2 minutes deeply in and out can literally allow your nervous system to relax and try to get baseline.
That is also so very true. And what I tell patients all the time is, like, think of it this way. Hundreds of thousands of years ago, our ancestors, right?
Yes.
They were wired to survive.
Yes.
And if you were, say, about to be eaten by a lion or a bear, it helped to have your physiology, your body, undergo some changes, right? To give you advantage. Your muscles get tight. Your brain would focus on the threat. Your lungs would open up. Your heart would beat fast. Really, even your gut, it would affect the physiology of your gut. You're not going to rest and digest food if you're constantly under tension. It would lead to this like widespread host of physiologic changes from head to toe to give us a survival advantage. Well, guess what? In the modern world, right, the threat is no longer a bear or a lion or a rival tribe or whatever, but it's the late report or the traffic jam or the difficult child or the long work schedule. But the physiology is the same. The physiology is the same, and it is so impactful to, our health. And so many of the physical conditions and ailments that I deal with as a primary care doctor, if they're not outright caused by stress, they're at least exacerbated by it.
Yes, 100%. And there's a lot of people experiencing more heart conditions, diabetes, and the medicine allows us to treat the symptom. And a lot of people come to me because of some of those ailments. And when we break things down, when we get to the root of the problem, so for instance, somebody's going through something, they struggle with migraines. And then because we're working so close together, I'm like, oh, the migraines seem like it started when this situation happened. And they're like, oh my gosh, you're right. The more we get present, we start to recognize and create, see the trajectory and how when stress happens, the migraines happens, the back pain happens. And the more that we can get in tune to this, we can stop pressing the brake and the gas, right? And but being present for some people is really challenging because maybe at some point in their life, they dealt with a lot of trauma. So they escaped by thinking about the future or just by daydreaming about something else. And so the peace is in the moment. And that's the thing that I talk about a lot with people.
Absolutely. And if you think of the things that a lot of people like complain about or things that bother people, energy, low energy, chronic muscle pain, migraines and headaches, digestive problems, bladder and urinary problems. All these things are really wired from our nervous system, and in particular from something called our sympathetic and parasympathetic nervous system, right? Which is our sort of fight or flight response that is that ancient architecture I was talking about earlier. And so like people will come in and, you know, they'll complain of like these non-specific bowel complaints or non-specific urinary complaints. We do like $1 million workup on them and we find nothing there. And then we're just left with the fact that, okay, this is stress. But where I get a lot of pushback from patients, and I'm curious what you have to say about this, is that when you tell people maybe stress is a part of the illness, they push back because then I'm saying as a doctor, it's in your head. And I'm not saying it's in your head. It's real. It's just that the stress is contributing to it.
Yeah. So I'm laughing because at the age of 19, I was dealing with a lot of stress. My oxygen level dropped below 90. I was in the hospital overnight. They did all these tests like Dr. Tian's talking about. And the doctor came in. They're like, well, everything came up clear. I think you should see a social worker. At that time, I wasn't into mental health. I was like, these people think something's wrong with me. I was offended that they thought I should see somebody and talk to. That's just how much I didn't understand how much the body and mind played a role. And I love sharing that story because I talk about it a lot. And I was over 20 years ago, but I want people to know just because you haven't been brought up in the world of understanding it doesn't mean you can't understand it now. Literally, my body was breaking down on me because I just kept going and I was living in survival mode and I had to slow down. You're so right.
It is. And you know, the thing is like, look, it's called being a human being.
Yes.
It's literally hundreds and hundreds of thousands of years of evolution in your body that make these things real. So, you know, there should be no stigma or shame.
Yes.
And you know, in admitting, okay, like maybe sometimes I internalize this. The other thing that I want to run by you that I run into a lot with patients and myself, if I'm being honest, because I'm a human being too. And I think this is all part of that ancient physiology. Like, look, if you're about to be eaten by a bear, right, it helped to be able to focus your attention, your brain on that bear, right? Because that's a survival advantage. Well, guess what? When your threat is internal, whatever your threat is, internal or external, if you find it threatening, your brain tends to focus on what you find threatening. That is survival physiology. And I think that is a huge part of stress, where when people are threatened by symptoms, when they feel out of control, when they feel disempowered, when they feel threatened, they do tend to focus more on it.
Yeah. Yeah, it's true. I mean, the mind goes at the pace we tell it. It's 2026. But if I have a feeling that is similar to something, if I was in a car accident at age 10, and I'll give a real example. I've seen a kid get hit by a car by McDonald's, and he was okay, but it felt scary to see it. And it was around my office. And so for the next few weeks, every time I drove by McDonald's, my stomach started to drop. I would feel anxious. Nothing was wrong. Right. And so so I had to tell myself, I would say, Celeste, it's fine. Nothing's wrong. The more I did that, the more present I became. That was something where the kid was okay. People have gone through a lot of hard things and they haven't processed it. And if you don't process things, guess where it stays? It stays in your system. And just because it's not on your forefront, your body keeps the score. There's an amazing book called The Body Keeps the Score, where it literally talks about how the body holds on to pain. It holds on to things. And so you've experienced things that you can't escape, you can't change. I think that's why like addictions happen, right? People are trying to escape the pain. Let's try leaning into it, right? Let's try naming it. Let's try grieving. There's things we need to grieve, things we need to name, things we need to say, like, this feels scary. And the more you say that, your mind is just trying to figure out what's the issue. And so if you're not answering that question, it's just going to keep, okay, a car is coming, get scared, Celeste, because we're trying to protect you. Your system is doing what it's designed to do when it happens that way. But you have to engage with your mind and say, hey, thank you for protecting me, but I'm okay.
Absolutely. And I feel like really what you're describing is really like the first step, which is sort of this ancient, you know, kind of often thrown about term, which we call mindfulness, right? Which is just like bringing a light of awareness to our inner reactions. Maybe we don't solve them. Maybe we don't cure everything in one fell swoop, but just saying, okay, I'm having this reaction because I am driving by the McDonald's where I saw the child get hit, or I'm having this reaction because this brings me back to a traumatic experience I had when I was young. And just shining the light of awareness is like the first huge step.
Yes, yes, yes.
And maybe
yes.
the hardest step for a lot of people, by the way.
Yeah, and I wanted to say, like, even though as me and Dr. Tian are talking about, it's just the first step. Just know, like, it's we're talking about it as if we're walking over a puddle, but it feels like you're walking over the Grand Canyon, right? Like it feels scary if you're not used to being mindful, if you're not used to being present. Then trying to do that, you're really fighting against yourself. So there is going to be some discomfort there, and I think people don't go through with the process because it feels scary to go on the other side.
100%. So I'm sure as a licensed mental health counselor, you're trained to deal with also serious mental health problems. Is there ever a time or a person where you feel like maybe the wellness thing isn't appropriate, where someone comes in and you just feel like this is me? I mean, do you look for that when you bring people in?
So, I've worked in ERs and the streets, the shelter. So I meet people where they are. And sometimes people aren't going to come into the wellness center and talk, and being around people may be hard, or it's so dysregulated that it's really hard. So the thing I really work with people on is the mindfulness piece and just being present. I tell people, even if it's just 2 minutes out your day when you first wake up in the morning and get in the shower, allow yourself to breathe. We're looking for big moments, but it's the smaller moments that add up, that create the bigger moments. And I think we don't put enough emphasis on the extra sleep that we get, or the walk that we take, or the foods that we eat, and how they can help regulate us. If we start putting emphasis on the little things and stop looking for bigger things, we'll start to see the deposits add up. Just 1% every day, 1%.
So at the Wellness Center in Stoughton, conveniently located in Stoughton for many of the people in Massachusetts in the purview of the voice of this podcast, I might point out, what services do you guys actually offer? You do therapy, you do yoga, you do stretching, you made reference to some nutrition. What else do you do there?
So we do workshops. We have like managing your anxiety and your thoughts. We are in the process. We were getting inspected of opening a partial hospital, and basically it's a step down from an inpatient, and insurance pays for it. So a lot of times people, I worked in the ER for 4 or 5 years, Carney when it was here, Children's Hospital in Tubbs, and people would come in and they would be struggling and they're say I need to go inpatient, but a lot of people don't know there's a thing called partial hospital where you can take a break from work, come in and get groups, have groups done, and it's paid for by insurance. I was able to sign on a doctor, so we'll have a doctor that will be prescribing, and it was conveniently located in Stoughton. So there's so many different modalities and services that people can tap into that will work for them.
And for the partial hospitalization, you're going to do the mind and body stuff too?
Correct. Yeah. So that's what's going to make this unique, is that we're going to have those same classes that we offer in the evening. We're going to offer it in the day, because when people are at the point where they are struggling and they need to take a break, a lot of people are taking leave of absences with just being home, which is great. You're getting that break. But imagine if you can like fulfill your spirit with more things to help you. So when you do get back to work, you'll feel like because taking a break is great, but what are we doing with that break, right? And I think that's why, with the pandemic started, I knew that the isolation and the mental health stuff was going to rise. And so I started being proactive and created these services because I knew the need was there and I knew money was going to be an issue. So I wanted to create spaces where insurance was going to be able to help pay for it.
That's really great. Producer Dave, do you have any questions for our friend?
I have a lot of questions, but time does not permit me to ask them all because, as you know, Dr. Tian, I do have problems. Now, I don't want to make light of mental health, of course, but what's to you, Doctor, the most misunderstood concept around mental health? What do people? I mean, it used to be that everyone thought that you could just shake it off. Are you a little depressed? Shake it off. Have a drink. Is that still a myth, or are there even other myths maybe that we're not talking about?
Right. So, at 19, I said, I was like, oh, these people think I'm crazy. Something's wrong with me. And I think because of social media and the internet, I think people have normalized mental health. But I think that some of the myths, people don't realize that the things that are happening in our system is normal. When I drive by the McDonald's and my stomach drops and I get nervous, my system is doing what it's designed to do. Like Dr. Tian said, it's trying to protect me. but then I have to come in and say, I'm okay. And so I think when people have these feelings, instead of beating themselves up, we are our biggest haters. We walk around 24/7 bullying ourselves and being mean to ourselves for how we feel, when it's like, if we can just stop and say, no, Celeste, your system is doing what it's designed to do. It's okay that you're still grieving. It's okay that you're still sad about that. Like, you're not a robot. I constantly have to tell my clients, you're not a robot. Of course you're going to feel sad about that breakup. Of course you're going to be sad about that job loss. Like, why am I not over it? So I think that's one of the biggest things I see, is that we are walking around being so mean to ourselves and not realizing, like, our system is really doing what it's designed to do.
You're not a robot, and your doctor or therapist should not be a robot either, right?
Wow. That might be the way things are headed in the world soon. Just a couple more quick things, Celeste, and then we're going to let you go.
Okay.
There are a lot of people in the world now that probably don't or wouldn't identify that they have a mental health problem, but would probably greatly benefit from the kind of services you're offering. Would you agree with that?
Yeah, I would agree with that. Yeah. I think on a spectrum, like, adjustment disorder is a disorder I use when I diagnose people. Basically, there's some adjustment in your life. At some point in our life, every single human being has had an adjustment disorder, which is in the DSM. And through these adjustments that happen, if you're not dealing with them, then they be turned into greater, disorders that we end up naming. And so I think that for people listening, don't be afraid to name what you're feeling or what you have going on, because when you can't deal with anything if you don't acknowledge it exists. If I'm going to Dr. Tien and I'm bleeding and he doesn't know what's going on, and it's hard for me to operate in life if I don't have a diagnosis, if I don't know what's happening, which is why people struggle with saying, like, oh, well, maybe it's mental health, because we're not used to, like, something that we can't see being an issue because we're not talking about it. And so you got to remind yourself that what you're feeling is real. It doesn't mean that it's a fact, right? Just because Dr. T might remind me of somebody else, and I'm like, oh my gosh, is he going to do something? And it's like, the feeling is there, but it's not a fact. And so if we can acknowledge the feeling, that's really the first step to healing.
That's wonderful. Okay, last question. The Shifting the Way You Think Wellness Center, for people out there that are in the area that have heard about it. By the way, do you offer remote services for people that aren't in the area, just out of curiosity?
Yeah, so we're on Mind, Body, and ClassPass, and we're going to be having the classes on both of those apps virtually as well. That's
awesome. So for people out there anywhere that are really hear this and like what you say and want to take on this more integrative, sort of holistic mind-body approach to their own mental health and wellness, what is the best way that they can do that in your center? What's a nice first step way that they can connect with you guys?
STWYT.com, STWYT.com. You can find all the information there.
Shifting the Way You Think.
Yeah.
That's right. It's just STWI. Yeah. Beautiful. All right. Awesome. Well, listen, this was really wonderful. Producer Dave, anything else you want to add?
No, I'm healed. But as far as everyone knows.
Producer Dave and I are going to go have a good cry after this. And, and we've got a lot to talk about here.
That's therapeutic. Yes, I love it.
Yeah, they're very therapeutic.
Thank you so much for having me. I really appreciate this. This was a really good conversation.
It was wonderful. And please stay in touch. And you know what? I'm going to send some patients to you. I have some when patients come in and I feel like they would benefit from your services.
Yeah, thank you so much.
I think that I have a lot of people that I think would do well. All right, Producer Dave. Well, that was really great.
Fantastic guest.
Another excellent guest. Are there any tissues in here? No, just kidding.
We should keep them on hand,
we really
right?
Should. Between allergy season and my burgeoning emotional sensitivities from.
Yeah, allergy season is killer to me. But you got into it a little bit. But it must be a challenge for you treating people for what they come in. They come in with a physical injury, and you're sensing a mental health issue. Does that happen a lot?
It happens all the time. Yeah. In fact, sometimes. It happens all the time that it is a mental health issue, and sometimes there is a physical issue. Sometimes there isn't a physical issue, and a lot of times my job is to provide support to people. Mm-hmm. And one of the things, Dave, that I've learned from my years of practicing medicine is that not all suffering is death and disease. There is a lot to suffering that has nothing to do with it. And you know, when we as doctors, how we treat people, how we speak to people, how we reassure people, how we make them feel supported, that can make such a huge difference for their experience.
Absolutely. Well, it's great. It's great you have someone like Celeste, Dr. Celeste, to refer to, because she's the expert. Stoughton's very convenient for me too.
Absolutely.
I'm
it's very convenient for a lot of people. It's a lovely community, just a lovely community.
Sure.
And there is a McDonald's. I can fact check that story.
I think there might be more than one, but yeah.
Very good. Yeah, it's a little bit of a fast food mecca, actually.
Oh, Stoughton, 138.
Yeah,
sure.
there's quite a few places. Yep. All right, let's move on. Let's get to In the News, because we got some terrific stories I want to talk about.
In the news.
In the news. Oh my God. Where else could we begin in the news this week but with the Hantavirus story? This is a sad story and a horrible story. Passengers on the Hondius, as of today, have disembarked and are quarantining worldwide to prevent the spread of Hantavirus. Global health officials are warning that the number of hantavirus cases could rise. One American who was on the cruise ship at the center of the outbreak. Everyone's quarantining right now. I think there's something like 45 people that are still quarantining as a result of this. Unfortunately, 3 people have died. Absolutely crazy story with the hantavirus. Producer Dave, you, I think, are a veteran cruiser.
No.
You've been on
I've
cruises?
always wanted to be go on a cruise,
No?
but I've never been on a cruise.
You've never
No,
been
I
on a
don't think
cruise
so.
before?
No, not like one where you actually sleep.
Would
Harbor cruises.
Would this deter you from going on a cruise?
I don't think so, because I think one of the risks you take when you go on a cruise is that you're possibly walking into a petri dish of germs, and you just got to roll with it as best you can. I mean, I tend to be a little bit more cavalier than most people. I think to me, it's the same thing as you go into a restaurant, you're going to a public pool, you're going to a hotel. Right. You do your best to avoid the really dirty spots, but other than that, I don't know.
I mean, what's crazy about this story is that, the hantavirus is spread by basically mouse droppings. And it sounds like the people got exposed to the mouse droppings before they got on the boat, is my understanding. And then they went on the boat, and because some people had close contact with each other on the boat, it was able to spread. Hantavirus is not a virus that typically spreads from person to person. There's like 40-something strains of the hantavirus, and only one of those strains actually is known to spread from person to person. And it just so happens that that was the strain that this person was infected with. And that's how this whole thing started.
Yeah, and I think, sadly, this is one of these things that the media is going to pick on probably a little bit more than it should, because, if they got another, what was the poop cruise, the one, I mean, that was some real horror, and that was a big story. But I mean, anything that, all the experts seem to say it's not another coronavirus, so let's not paint it as such, but there's still bound to be a little anxiety over it.
Well, that's just it. And we all have PTSD from Corona because of how that all went down. But honestly, I can say confidently that that's not going to happen here. The hantavirus is not contagious enough. It doesn't spread through the air like Corona does. It requires really close personal contact, direct exposure to body fluids, kissing, maybe through food or whatever, but not from the kind of airborne spread that typically what you'd see with something like Corona or measles or something like that. So there's really no risk that this is going to become a global pandemic at all. So we won't have to wash our groceries again at any point in the next few months.
Should we ever have in the first place?
Well, exactly. That was one of the stupider things we did with this whole thing.
Yeah.
All right, let's go. Next story. This is another interesting one. RFK Jr., the gift that keeps on giving for all of us medical pundits. But as they say, a broken clock sometimes may be right. Broken clock is right twice a day, I think, is the old adage. U.S. to take steps to curb antidepressant prescribing, RFK Jr. says. Federal Health Department will soon begin a series of steps intended to curb antidepressant use in the U.S. RFK Jr. announced this week antidepressants, specifically SSRI, selective serotonin reuptake inhibitors, have long been a target for Kennedy, the health secretary, who talked about plans at an event last week hosted by the I can't read that part, but by the make some. But it was hosted by some think tank organization.
Sure.
So, long story short is RFK Jr. wants to curb antidepressant use. What say you, Producer Dave?
Well, he, like you say, let's not assume just because it's RFK Jr. it's nonsense. I mean, I know a lot of people that like, Prozac for life, and it really helps them get through every day. But I can see how, is there enough of a curb on, is there enough of a limit on these things for people to be, you're a better person to ask. I'm curious to hear what you have to say. I know that they've been prescribed. I've tried several. None of them really sat well with me.
Yeah.
But there was never a hesitation on the doctor to just say, hey, try this, try this, try this.
Right.
So,
I think, these medications are widely prescribed. I prescribe them for probably hundreds of people, but I try to at least have a conversation with everyone and put their use into context, because if you really look like discriminatingly at the studies and the literature supporting their use, it's really not great. and it's debatable at best if there is even statistical efficacy above placebo, if not clinically relevant efficacy above placebo. If you understand the distance, something could be statistically significant, like on a 100-point scale, it improves your depression from 43 to 45 or something, right? That could be statistically relevant, but it might not be clinically relevant. And if you look at it, it's debatable if there is actually efficacy above placebo for these medications, but I can tell you for sure in clinical practice, I have patients that swear by them. And I think that, I don't know if it's placebo. I don't know if there are some people that are serotonin responsive in their depression. Just like if you come into my office, say, and you have abdominal pain, and if someone cuts out your gallbladder, that's great if the problem was your gallbladder, but if the problem was your stomach, we've done nothing for you. And I think it's similar with these. Like, there might be some people that are depressed and have a subset of depression that's like a serotonin responsive depression. And in those people, these medications really help. And in other people, they don't. But overall, I do think people should understand there are small risks to being on these medications. They are not a panacea. I have many patients they do nothing for. And as I said, some patients, they really help. And I think that, in this one particular case, for a guy I've been pretty critical of on this podcast and some of the other stuff I do, I think in this one particular case, I kind of think he's barking up the right tree a little bit here.
Yeah. Is another possible downside of those pills that they have diminishing returns over time? Because I know some people that they have it has a great effect on them when they first start, but then over time it's like, I just got to stay on it. It doesn't do that much anymore. Yeah.
I mean, I don't know. It's so hard to get a real sense of that clinically, because if you look at these trials, most of them are like 12 weeks, 24 weeks, maybe a couple years. And in real world clinical practice, people take these medications for decades. So I honestly, Dave, I don't know how to answer that question. I would say that, if someone finds it helpful, then go with it, because the risk of, feeling depressed and down is there's a risk to that too. So if the medication works, it's probably worth it to be on it. But, I just think people need to have a little context. And I think it's important for doctors to kind of just explain the real evidence and the science behind this to patients, and not just hand these pills out, like candy to people and say, this is going to fix your problem, because that's really not the case. A lot of people, it really won't fix their problem.
Right.
All right, let's move on to the next one. This is an interesting story. FDA approves new motion sickness drug. This is from a place called, this is all over the place, but biospace.com. Vanda ends 40-year, biopharmaceutical company Vanda ends 40-year motion sickness drug drought with FDA approval for a new motion sickness drug called Neurius. Producer Dave, what do you think? New motion sickness drug, speaking of cruising.
Yeah. Does Dramamine not get I'm not one of the unlucky ones that gets crushed by but I know that my older son, he went on a cruise with mom once, and it was pretty bad. Actually, you know what? The one time I was seasick, it was horrible. Really? So yeah. But then again, I didn't even try the Dramamine. Doesn't Dramamine get the job done, or is this supposed to be something better?
Well, I think it's supposed to be better and a little more effective than Dramamine. But Dramamine is a very safe and generally pretty effective medicine. And of course, it's over the counter, which is easy. So I think it's going to be really interesting. But, for people with bad, severe motion sickness, sometimes Dramamine doesn't cut it. And I think that's where this drug will fit in.
Yeah. I had a friend who couldn't who could barely like travel in a car for long distances.
Right.
He was not a fun guy to have on road trips. Be like, pull over.
Yeah, right, 100%. Yeah. There are people like that. You know, I mean, you hear a lot of people, this is me, that they'll be like, oh, when I was a kid, I used to get motion sick and then I kind of grew out of it. And that's what I mean, when I was a kid, I used to like barf all the time. God, I feel so bad for my parents. In fact, there was one time, this is the truth, we drove all the way to Hershey, Pennsylvania, which is what, like a 9 or 10 hour drive from where we are, right? To go to Hershey Park. We made it all the way to the driveway of the Grand Hershey Hotel, the famous haunted hotel in Hershey, Pennsylvania, if you ever heard about it, right? Literally all the way into the driveway. Dad pull over, threw up in the driveway as we were pulling into the hotel after 9.5 hours.
Well, you shouldn't throw up in the car, right? That's the
goal, but when you're like 9, 10 years old, right? You can't help it.
No, right?
Yeah. But yeah, I mean, for all those suffering motion sickness people out there, there is a new hope. So it'll be interesting to see who can get this stuff and if it actually works. All right, next story. Another great story. This is a good one. This is right up my alley, man. Medical spa director loses medical license. Okay. This is from Wortham, Texas. Former medical director of a Wortham med spa turned himself into authorities on Wednesday, April 29th, facing 25-count warrant in connection with the death of a patient at a IV infusion med spa in Texas. The patient was receiving TPN electrolytes, which is IV fluid and electrolyte mixture injected directly into the veins. You see these infusion spas, they're all over the place. They're certainly here in Massachusetts. Bottom line is that the patient unfortunately died related to a potassium dosing error that led to a severe potassium disturbance, which led to their demise. And now both this doctor and the owner of the spa are facing criminal charges. They were charged with murder. They were charged with manslaughter and 23 other counts, negligence and some other stuff. I find this to be an amazing story. Now, you're a lawyer, so I'd love to see what you think about it.
Well, I'd like, with a lot of these procedures, the first thing that I think of is what kind of disclaimer did they sign? It probably was voluminous. That does not necessarily going to protect them completely across the board. If they were grossly negligent, then I think they probably could be criminally liable, and they're certainly civilly liable. But we don't know all the facts of the case and what exactly did this person have, some kind of pre-existing condition or something like that, or
I don't think they did. I think they were just a healthy person that walked into the spa and got a dosing error on the electrolytes, and it led to them dying.
Yeah, I mean, if I were the defense attorney for the spa, which it sounds horrible, but you wonder if that was a reasonable outcome out of that dosage. I mean, maybe it is. I've never heard of anyone dying from an overdose of electrolytes. Or is that what it was?
Yeah, potassium.
Yeah. Okay. So should they have known for sure to be very careful with dosing that particular thing?
Yes,
I guess is my question.
110%
they should have. Then throw the book at them.
Yeah, and what's really interesting about this, and I've been approached a couple times in my career with these kind of opportunities, and someone will offer me like a couple $1,000s a month to be the medical director for a Botox clinic, a spa, infusion centers. I've been offered a day camp in the past for kids. And you really have to be careful. This story proves it, where a doctor puts his medical license. Because if you're not there and you're not supervising, and this is all happening under your name and your license, it can blow back to you if something catastrophic happens.
Mm-hmm. Yeah, it seems like people think something like Botox or something like that could never be harmful, but I mean, please, time you're injecting something, a chemical into someone's body, I would want to make sure it's a physician under the optimum circumstances. I had a friend who was a dentist. I certainly won't say his name, but he used to we'd be like out at a swimming pool and somebody's pool at somebody's home, and he'd be poolside injecting Botox into my buddy's face.
Right.
He's a dentist. Right. No, maybe he was completely licensed to do it, but he's a dentist, and it's like, what are you doing?
Yeah, I mean that's obviously a little over the top, but at least that's a friend, right? And I feel like if it's a friend, they're probably not likely to sue you. Sure. When you have strangers coming in, look, everyone's all nice to each other and hunky dory, and it's all nice until something terrible happens, right? And then
Yeah.
all of a sudden it's, why'd you do this? And the first thing you're being asked when the plaintiff's lawyer calls you on the stand is, why'd you do this? Why didn't you see the patient? Where were you when this happened? Oh, you hadn't been there in 3 months. When was the last time you were there? And next thing you know, your career is ruined. So you really have to be careful. I was approached with an opportunity about a year ago to be the medical director for a kids camp. And they wanted to give us a free membership to the camp and the facility
For your kids. Yeah.
Yeah. And I was like, are you out of your mind? Like, you want me to be responsible for like 200 or 300 kids? A kid gets stung by a bee, and you know what I mean?
And they didn't even want you to be on site? I guess not, right? I mean,
not to mention the fact that I'm completely unqualified to take care of anyone under 18. I haven't done it in like 15 years.
Okay.
You know what I'm
Yep,
saying? So
yep.
it's like, you really have to be, I think, very careful with where you put yourself and the situations you come in. Sometimes, a couple $1,000s a month to do next to nothing, it sounds great, but it really is never look a gift horse in a mouth, as they say.
I mean, you're a doctor. You're a licensed physician, and to go through all the schooling that you had to do and to get your degree and everything,
Right.
doctors take their jobs extremely seriously. And so you go to them and say, "Hey, just put your name on this.
Yeah.
It'll be okay. You know, we're just kind of putting your name to it."
Well, that's just
that's trouble, right?
And the business people, trust me, they tell you they understand, they don't. They tell you they care, they don't. They want your signature so they can make money, and it'll probably be fine, and it will probably be fine. But if it doesn't, it can be catastrophic to you. Okay, let's talk about another good one. Everything seems to be about cruise ships this week. Doctor delays telling woman she has incurable cancer so she can enjoy her cruise. I'm not going to mention the name. This was from the Sydney Morning Herald a few weeks ago. Woman presented to a doctor with a cough. Doctor told her it was 99.9% not cancer. She thought it was a non-contagious infection, which sounds a little weird to me because how could you know it was non-contagious? But she got on the ship anyways. When she returned from the boat, it turned out that she had incurable lung cancer. The doctor waited to tell her until she got back from the cruise. Producer Dave, what do you think about that? The doctor said he wanted to let the patient enjoy the cruise, but I don't know. Would you want to know before the cruise or after?
I don't think that's the issue, because I think that's actually a fair question. I mean, I'm trying to see how old this person was here. 70-year-old Jenny Scott. Yeah. So, did you not want to say her name? Sorry. No. That's a published report here.
Yeah, it's true.
She was 70, and I mean, arguably, maybe she wouldn't want to know. Arguably, she's 70. She knows she just wants to go on this cruise and enjoy herself. But as a physician, I would think that's beyond the pale. You can't just not tell them because they're going on a cruise, right?
Probably not. I can tell you, as a patient, I would not want to know.
Yeah,
don't blow up my cruise, man. Nothing's going to change. Let me go enjoy myself.
Yep.
You know?
I mean, that's a tricky one, right? I mean, do you have a duty? Do you necessarily have a duty to tell a patient the truth all the time? You kind of do.
I think you do.
Yeah.
And I think there are ways you can tell people honest information in a way that is supportive and kind and reaffirming and as positive as possible based on the nature of the information. So do I think the doctor made a mistake? Yeah, probably. Would I do that? No. As a doctor, I wouldn't. However, as a patient, I would have 0% problem with that, especially if it wasn't going to change anything anyways. I would almost feel like I was given a gift of this one final cruise before everything went to shit.
And like a lot of things, there were extenuating circumstances here. If I'm reading this correctly, he found out while she was already on her way to the cruise, and rather than try to figure out with her, he planned to tell her at their consultation, which was set for the day after she returned, a week after the results came in.
Yeah.
So that doesn't sound so outrageous to me.
I don't think so.
Yeah.
I don't think so. And one of the things is in my office, when we have a situation where it could potentially, have serious implications, we order a test or something like that. We always just schedule a telemedicine visit to review the results so that's on the book. So whether the test comes back favorable or unfavorable, that time is booked for like a week from then. So that's when we're talking about the results. So you don't have to worry about getting a call, not getting a call, what it means. Next Thursday at 3:45, you're going to get a call and someone's going to go through the result with you. And that's the time. Now, obviously, if we get something and something comes back and it's super time sensitive and dangerous, then we're going to pick up the phone and call the person right away. But it also, if it's just something that's not an emergency, even if it's bad news or if it's good news, the person isn't left waiting and wondering.
Right.
All right, next story. This is another good one that I think is very much a lawyer-related type thing. Yeah. Florida surgeon who removed wrong organ says he is forever traumatized by patient's death. Florida surgeon Thomas Shaknowski faced the same question again and again. This is from NBC News. Why did he remove a man's liver instead of his spleen? Disastrous August 2024 surgical error and death of the patient on the operating table prompted the widow to file a lawsuit last year and a grand jury to indict Shaknowski on a manslaughter charge last month. He has pleaded not guilty. Producer Dave, again, as an attorney, removing the wrong organ. Now, there's mistakes I can understand happening. Liver is on one side, spleen's on the other. You're a surgeon, bro. How do you screw that up? I don't know.
It says here that in his deposition, he said there were unusual factors that made his procedure more difficult, but I don't know. I mean, if you're a surgeon and...
my 4-year-old can do this and go left from right.
And the spleen versus the liver? No, sorry. That's... It seemed to be way below the standard of care. Now, I don't relish throwing this guy in jail because I have a feeling he was just horribly incompetent. Unless he was drunk or something, but that doesn't seem to be the case. So but yeah, my dad once went in for a procedure to have like a tendon cleaned up like below his finger. He had that trigger finger condition, and this was going to fix it. And when he got out, he looked at the scar on his hand, and he was like, I think that's the wrong finger. And turns out he went to the doc, and the doc said, Saul, you're absolutely right. I have no excuse. I checked my notes 3 times. It was and I thought it was the right finger. It was wrong. And I think my dad suggested that the doctor thought my dad would sue him, and my dad said, no, just do it again.
Wow.
Because he really, it was a long time doctor and it was an honest mistake.
Right.
Now, but that's much different than this. My dad his hand might have been a little bit sore than normal, and they go and they fix it. But this is like Ripley's Believe It or Not. It's something that happens hopefully one in a zillion
You
times.
hear these stories, and like a lot of them, they're bad, but you can see how it would happen. Like you get the left knee and it's the right knee, or the 4th finger instead of the 5th finger, or something like that. I'm not saying it's excusable. I can see how that happens. I cannot imagine how a surgeon who's operated for decades could confuse a liver and a spleen. Right. I don't understand how or why or what prompted that to happen. I don't understand.
It also begs the question whether there were other eyes. You would know better than I. When I see surgeries depicted, it's seldom just the doctor with his eyes on the procedure.
Totally.
So you wonder why somebody can say, hey, doc.
You would think there would be, if not a resident, a physician assistant, someone to hold a nurse, a tech. Really. And, they're supposed to do a checklist, which is really improve patient safety. That's sort of the thing. They do this checklist now, and a lot of it is completely and totally mundane. But it's like an airplane. You got to do a checklist to take off, and it's all designed to prevent that 1 in a million catastrophic outcome. So they must have just skipped like all kinds of like safety measures. Not only total incompetence by the doctor, but just a complete and total failure of procedure.
Yeah, you would think. Yeah,
but it's hard to imagine. Okay, next one, an interesting one here. This one also out of NBC News. Most patients don't know doctors are using AI. Over the last 2 years, medical providers across America have quietly embraced a new AI tool called Open Evidence to help them make clinical decisions, brush up on medical knowledge, and even prepare for their license exam. The service was used by about 65% of U.S. doctors across almost 27 million clinical encounters this April alone, a company told NBC News. Producer Dave, do you think that patients should know if their doctor is using open evidence or AI to help them?
My gut reaction is no. I don't think you need to know. As long as the doctor is providing the best possible care, with or without the use of AI. It's not the robot that's talking to you. So now if the doctor relies on AI too heavily and just asks ChatGPT a simple question, hey, I shouldn't joke, but hey, ChatGPT, is this a liver or a spleen? You know what I mean? So
if only he had done that, he wouldn't be here right now.
ChatGPT would probably even get that one right. We know ChatGPT and other AI robots can make mistakes, but what I'm thinking is almost in every professional walk of life, you're going to find some useful use for AI. Let's say a doctor wanted to know, the last 36 times this particular ailment had come up in this particular situation, and AI was useful in gathering that information. I mean, I certainly wouldn't have a problem with that. I would have a problem if after the surgery goes awry and the doctor says, well, AI told me to do it. Obviously, you
AI
can't do
told
that.
me that was the spleen. Right. It was the liver.
Right.
It's not my fault. No, I agree with you 1,000%. A doctor using AI is a tool. It's still the doctor that's taking care of you. I don't think patients necessarily need to know this. Doctors have been using online resources for years. Up to date is literally the backbone of our healthcare system for the last 25 years. It is an online reference database that really provides the most, I would say, quickly, succinct, summarized, evidence-based articles on pretty much every medical topic. And I grew up in that era where we had access to that, and we were able to access any sort of medical article, journal, topic in a way that was so easy to digest and palatable at the tips of our fingers. It's made medical care better, and this will too. This is very different than, say, AI taking care of someone.
Right.
People need to know about that and have the right, I think, to say no if they don't want it. This is a human doctor using AI to help them in their decision-making and get information to them. I think that's great.
Yeah, this will be my simplistic non-medical observation, but I do watch the TV show The Pit, or I have watched all the episodes, and in all the chaos of an ER, I'm struck by, whether this is realistic or not, that when they're considering all the possibilities for what's wrong with this patient on the gurney right now, inevitably there's the three things that are main, but also it could be this, and it could be this, and it could be this.
Right.
And sometimes it's just one guy who just wanders in, says, have you considered this? And they all look around and go, no, we didn't consider that.
Right.
Well, I wouldn't have a problem with quickly asking, hey, what are the 10 things that could be wrong with this person? And then you go and actually examine the patient to figure out.
100%.
Yeah.
I'll tell you a little story. I had a very minor medical thing that required me to get a diagnostic test recently. And, long story short, I use ChatGPT to help me understand the findings on the exam. And I'm going to tell you something. For the first time in my life, after doing this, I have come to believe that AI might replace me someday. The ChatGPT was more knowledgeable, more evidence-based, frankly, more sensitive and compassionate and patient than the human doctor that had ordered the test. So,
wow.
I never really, as a patient, used ChatGPT before, but it really was an eye-opening experience. So I think the technology is evolving, but that's really not what this is. This is a little different than that. Okay, let's move on, Producer Dave, to the best part of the show every week, because I know we're running short on time. Right. The non-medicine topic of the week.
The doc is off the clock.
All right.
So it's time for the non-medical topic of the week.
All right. Kick off your shoes, turn off your pager, fall asleep in the closet. We are off the clock.
Truth comes out.
The truth comes out. Okay. The non-medicine topic of the week, Producer Dave. UFO Files released last week on a Friday afternoon by President Trump. Your take on what was released? Before I give you mine.
No, I guess I didn't see anything really of note. Was there? Please tell me if I'm wrong. What did they find that was? I mean, I don't remember any sightings of little green men, right?
Totally.
It was just some stats, right? What was it?
It was just pictures of orbs flying through the sky,
which
and
we couldn't identify this, we couldn't identify that.
Different things that really could have been anything. Look, there was some interesting stuff that I saw, and maybe stuff that couldn't be necessarily explained. There was nothing earth-shattering. This whole thing, that was just I thought it was a disappointment. It was underwhelming.
Well, our president likes attention and he likes headlines. And, we talked about on this show when he strangely decried Tylenol, even though he couldn't pronounce acetaminophen.
Right.
But I'm starting to
You
come
can't
around.
pronounce acetaminophen without ass. Producer Dave.
So, I hate to say this, Dennis, but I'm starting to think that, not that we're alone in the universe, but that I think you and I might leave this earth without having met an alien, just because I saw Stephen Colbert interview former President Obama recently, and he asked him about like the UFOs, and Obama said, "I'd like to believe they exist, but there are no secret files of little green men that I've seen that everyone else hasn't." Okay,
Right.
And I believe him.
Yeah,
so
I do too.
I think we're still waiting.
Yeah, I mean, do you think there's any chance that they said they were fully transparent, but maybe they actually weren't fully transparent, that there is still things that they're holding on to? That's what the conspiracy theorists are saying, that this wasn't really the full release.
I like a good conspiracy theory, but I don't know, you compare it to something like, JFK's assassination. Like, in theory, there were people involved in that assassination that have since died, and they took their secrets to their grave, and there was a reason why, because they didn't want to get pegged for murder. So
Right.
That's logical. What's the logic behind holding back all this information about aliens? I don't know.
Yeah, I mean, people would say to protect people from themselves, or I don't know. I don't know. I mean, I don't know. Like, I thought the whole thing was like underwhelming. I really
Yeah, me
did.
too.
Even if they didn't have little green men, there was really like nothing that I would say like objectively, like, okay, that couldn't be explained by some other kind of thing. What's the thing on Star Trek where they can't mess with the other planet? They have a name for it. Do you remember the name?
No,
It's
it's
this
like some sort of
Principle or something.
like-
The first rule or
like
something.
space perestroika kind of thing. Like,
Yeah, it's like called the primary principle or something like that, and they can't mess with any of the planets they go to. So I don't know. I wonder if maybe that's the case a little bit. But as for like the smoking gun type thing, there was nothing there.
Yeah, we're still waiting for that.
And how quickly it was forgotten about too.
Yeah, the Prime Directive.
The Prime Directive,
also
yes.
called General Order 1.
Yes, the Prime Directive.
Thank you, ChatGPT.
Are you a Star Trek fan?
No, I don't mind it, but a little bit more of a Star Wars guy.
I'm kind of both.
You could be both.
Star Trek is exceptionally well written and thought provoking. It really is. Okay, should we head right to the Boston Sports Minute, the best part of the show potentially?
Let's do it.
It's the Garden. It's Teddy Ballgame. Yaz and Poppy in Noma. It's Brady and Larry and number 4 Bobby Orr. It's Fenway Park. It's the Boston Sports Minute. Let's go.
Dark days.
Across the board.
Across the board on the Boston sports calendar. I don't know where to begin. Let's start with the Bruins and the Celtics bowing out of the playoffs unceremoniously.
Yeah.
Tough beat for the Celtics, producer Dave.
Yeah. The only bright side, if there is one, maybe, is that Brad Stevens isn't afraid to make changes. And so I'm not in love with this idea of trading Brown for Giannis, but maybe Giannis is potentially more of a game changer. But I don't know. It's weird. I have this. I've always defended Missoula, but I have this sneaking suspicion that maybe throwing up all those threes, maybe we should try something a little bit different.
110% agree with that. And look, do I think that trading Jaylen Brown for Giannis will make them a better team? I'm not sure of that, but I think they'll be a way more watchable team.
True.
And if you're looking at this from an entertainment perspective, as good as they've been, they're boring. They're hard to watch because of the way they play the game. And oh, by the way, it's pretty clear that the way they play the game is not really effective or sustainable in the playoffs.
That's right. And there has to be some kind of tipping point. I think it was either last season or the season before where the Celtics legit became the first NBA team to take more 3-point attempts than 2-point attempts. Right. And that they're not the only team to go so heavy in that regard. And in some sense, I think the nerds think it's just math. You get one extra point, obviously, if you hit it, even if you lower percentage. But it eventually detracts from the look of the game, and you're sitting there just waiting, just praying that the threes start to go in.
Right.
Why not at some point rely back on fundamentals? And growing up, I grew up with the Larry Bird era. He was a great shooter, a great scorer, a great rebounder, but there was nothing better than a Larry Bird pass, blindside pass, zip right underneath. That's more fun to me.
Yeah,
typically.
well, you know what? The Celtics in the playoffs this year were like me at the casino on the Royal Caribbean cruise I went on in January. I was playing blackjack. It has to get better. It has to regress to the mean. I have to start winning. $1,000, $1,200, and like 3 hours later, right? I'm walking out of there with my tail between my legs. They kept firing up threes, expecting things to sort of normalize. It never happened, and it just fell apart. They have to change the way they play because it doesn't work. And you know what? The other thing that was crazy, and then we'll move on to something else, is like this guy, Joel Embiid, he has just been like a dog his whole career. He has been underachieving, underperforming guy, never come up big in the playoffs. And then somehow, and that whole team is really, you say the same thing about Paul George. Somehow they figure it out. For these 3 games, they figure it out. And then they revert immediately back to skunk form against the Knicks. And the Knicks blow them out of the water in 4 games.
I know.
It was tough to watch.
Yeah. Well, Embiid was almost unstoppable, but it seemed like we were kind of stubbornly sticking to the game plan, and Missoula got out-coached by Nurse.
Yep.
But yeah, it doesn't reflect well on the Celtics that the team that just dispatched of them, the Sixers, look like absolute dogs and getting swept the next round.
Absolutely not. All right, very quickly, our Red Sox. That's another one altogether. Producer Dave, like, what do we do? I feel like this is going to be a lost season. You know, I've always say baseball season doesn't start until July 4th. Doesn't start till the All-Star break. Whatever. This team is. It looks like it's just a fundamentally flawed lineup in particular.
Yeah. You and I were exchanging texts of despair the other night when they were losing. Like they lost went down meekly 1-0 to the Phillies. The depressing thing is there are young stars, but it's starting to look like there's no, I don't need the 78 lineup with Rice, Lynn, Fisk, Yastrzemski, Dwight Evans. I don't need that. And I don't even need Ortiz and Ramirez, but I need a couple guys who can hit home runs. Right. It seems like we're waiting forever to scratch together a couple runs here and there. And I like these young arms. So I'm torn because I think this could be, we could, look up in a couple months and we're still 5 games under 500 and just forget it. But there have been seasons where they've managed to squeak out things. I liked Cora, though. I don't know. I'm trying to be hopeful, but yeah. What do you think? Are you giving up already, or?
I'm not totally giving up, but it doesn't look good. I just don't know if they have the ammunition, the lineup to pull this off.
Yeah. If you were Breslow, would you try to make a couple deals? Or do you, obviously at this point you probably wait and see where you are.
You got to wait and see. You got a month to figure this out, and if you haven't figured it out by June, then you got to bail.
Okay.
All right, Patriots schedule coming out. We'll talk about that next time. I think we're going to wrap up this episode. Want to thank everyone that listened to this episode of the Modern Medicine Podcast. Hope you all enjoyed it. We'll catch you next month with another episode. Be healthy, be well, be safe, everyone, and thank you.